I agree to the terms and conditions, cookie and privacy policies, and Castle Agreement. A 3-year study dubbed Project ACL launched Tuesday with the goal of reducing anterior cruciate ligament, ACL, knee injuries in women's soccer. The project is a collaboration between FIFPro, England's Professional Footballers Association, Nike, and Leeds Beckett University. FIFPro is the global union for professional football players representing some 65,000 players. ACL injuries are 2 to 6 times more likely to occur in women than men, and some 2/3 of ACL injuries occur in women's football when there is no physical contact, according to research. And that number has not been reduced despite research and more professionalism in women's soccer. But FIFPro says there is little understanding about how to reduce such injuries in professional women footballers, with most existing research and injury reduction programs focusing on amateur players. This is a response to the players rightly calling for more research, said Alex Colvine, FIFPro's head of strategy and research for women's football and a former player herself. Probably since COVID we've seen a number of high-profile ACL injury in professional women's football. Canadian Janine Beckie, Australian Sam Kerr, Spain's Alexia Putellas and England's Beth Mead and Leah Williamson are among the international stars who have suffered recent ACL injuries. Project ACL will work proactively with the 12 clubs and approximately 300 players in the FA Women's Super League, FAWSL, to better understand their current working environment, identify best practice and provide solutions to support the reduction of ACL injuries. The study will include a review of existing research related to women's pro football, ACL injuries and existing injury reduction program, assess FAWSL clubs' resources and access to facilities, and track the workload, travel and activity of FAWSL players. FIFPro and the project partners will make findings of the study available to all football stakeholders including FIFA and regional confederations. Most of the research to date on ACL injury in women has focused on single-sex-based risk factors like the mechanics of female bodies, said Stacey Emmons, reader in sports performance at Leeds Beckett University. The research in Project ACL will look at the bigger picture to consider the gendered environmental factors that may influence injury risk in women's professional football. Fern Whelan, an executive with the Professional Footballers Association, suffered a knee injury while playing for Everton. So I know the hard-hitting impacts of ACL injuries and of knee injuries, she said. We see it as a real player welfare issue at the PFA. Emmons says Leeds Beckett University has been involved in research around the women's game for more than 5 years. But I think what's really missing from the research at the moment is that holistic environment,